Hello, this is Dr. Ramina, and today I will be busting all the myths regarding scaling. Scaling is nothing but cleaning of teeth in layman's term. However, in my daily practice, I come across patients asking me several questions regarding scaling, such as will it weaken my teeth? Will there be a gap? Will it cause problems with my enamel, sensitivity, and so on and so forth. So today I will address these myths. And one of the most commonly asked question about this is, will it weaken my teeth? So what actually happens during the deposits? How it develops is we have something called as plaque in our teeth, which is developed every single day, a sticky, soft material, or which when you wake up in the morning you can feel around your teeth. That needs to be cleaned every day with a brush and a normal paste. However, there are certain areas of the teeth which remains unattended or not well maintained, which cause developing of these plaque and remaining and making sure it remains in the teeth for a longer duration of time, which then eventually develops into a hard deposit, that is a tartar. Now, this hard deposit or a calcified substance cannot move or cannot be removed just by brushing. So, this is the part where we need scaling for, because we use ultrasonic thin light vibrations with a blunt tip, which helps to remove these kind of deposits. However, what happens is, because it starts developing, imagine this is the tooth and this is the gum. So usually our tooth are held by the gum just like this. But however, when there are deposits which are formed, it starts pushing the gums further down, and the deposit starts developing in this area. Now, when this happens, you might start developing a little bit of bleeding or sensitivity, because this area, which is not supposed to be exposed, is now exposed. So, in scaling, we remove these hard deposits around the tooth, so that the gums can go back to its original position, just like this. But what happens is, when the day when we scale, these deposits are removed, and this is the exposed area of the tooth. And that is when you start feeling that there is a slight mobility and weakening of the tooth, because the gums are not in its position. So it takes just a little while for the gums to go back to its position. And during that time, you might have that feeling of the tooth is weakened. But this is us making sure that all the dirt is out, so that the gums, being the healthy part of the tooth, can go back to its position. So that is the first myth, that it weakens the tooth. The second part is a sensitivity. So again, like when we remove this area, there is a possibility. This is like a live wire which is not supposed to be opened, and it's supposed to be encased by the gums, but it doesn't. And so what happens is, this area, when it touches even water or normal any other temperature, you start feeling the tinge or the sensitivity. So that eventually again goes off when the gums go back to its position. So for all these things, we end up prescribing gum astringent or some other toothpaste, specific toothpaste, so that it doesn't cause trouble. After which, the third most commonly asked question is, will it touch my enamel, or will my enamel get chipped? And the answer is absolutely no, because it's an ultrasonic machine with a blunt tip. Enamel is one of the hardest substance, and it is not so easy to just get it chipped by such kind of instruments. So we are just gonna remove this hard deposit or a calcified deposit of substance, which is actually been pushed into your teeth by the oral bacteria. And so no, there is no harm to the enamel whatsoever. The fourth question that most commonly asked is, why are the gaps develop? Now, what happens is, in between all these teeth, the dirt starts depositing, and again, your gums are actually folding in through each of the teeth, and there also the gum starts receding. So when we remove the tartar from the middle, you can see that the gaps which is being developed, and that is not because we are removing the hard tooth structure, it is just because we are removing the tartar which is present. So what we end up doing is, we just wait it out for the gums to go back and grow. by itself, unless and until there is some other pathological problems along with it. So there is no way that we are actually cutting on the tooth or creating grafts while scaling. And the last and the most, again, commonly asked question is, when the gums bleed, should we brush? Yes, it is important for brushing, because bleeding gums means the deposits are developing, and it is not healthy. So we need to address that issue and make sure you need to brush. Also visit the dentist regularly, scaled, so that you don't have to make sure that you have gum issues, gum diseases, as well as the tooth mobility or the periodontal issues do not crop up. So I hope in a very short way I have explained the myths regarding dental scaling. And I would suggest, as a dentist, for everyone to scale at least once a year, so that you do not develop doubt and have a good oral health. Thank you.